Deep sliding systematic palpation of the abdomen, sigmoid. Perform hand washing before the contact with your patient. Provide privacy. Prepare all the equipment on the procedure trolley. Greet your patient warmly and politely. Identify your patient. Take an oral informed consent. Explain all the steps of the procedure to your patient and or family present. Manipulation can be performed with disposable non-sterile gloves when it can be the risk of contact with the patient's biological fluids. Ask the patient to undress to the waist. Use supine position of your patient for palpation. The room should be warm, your hands should be warm, cut your nails before the palpation. The couch is prepared, clean with napkins, place a sheet. Sit on the chair to the right side of the patient for the right-handed doctor, to the left side for the left-handed doctor. The chair seat is at the level of the couch. The patient is lying on his back. His head is lying low on the couch. His arms are stretched out. The abdominal muscles should be relaxed, and the patient breathing should be calm, preferably with his mouth. Place 4 fingers, the second, the third, fourth, and fifth, the right hand together and slightly flexed perpendicularly to the axis of intestine, which runs obliquely in the left iliac region at the border of median and outer third of the linea umbilica iliaca. 1/3 of the linea umbilica iliaca. In the first method of palpation of the sigmoid colon, the palpating hand is initially installed so that the palm surface of the hand is directed to the umbilicus. On inspiration, a skin fold is created in the direction to the umbilicus. On exhalation, the fingers are going vertically down, and then the nail surface of the fingers slide in direction of the left anterior superior iliac spine, rolling through the sigmoid colon. You can check abdominal breathing of your patient. Breathe in and breathe out. And after that, palpation. Breathe in, skin fold, and breathe out. Palpation. Breathe in, skin fold, and breathe out. Palpation. In the second method, the palm is facing to the left anterior superior iliac spine. With a superficial movement during deep inhalation, with the abdomen, the fingers are displaced medially and the skin fold forms in front of the fingers. Straighten the fingers of the right hand until the fingertips touch the posterior abdominal wall. At the moment, then the patient exhales deeply. At the end of exhalation, the fingers slide along intestine laterally and downward, and later the sigmoid colon is palpated. Identify diameter, consistency, surface, mobility, pain, and rumbling phenomenon. For example, you palpate 2 cm in diameter, smooth firm cylinder, painless, easily displaced in 3 cm, doesn't rumble, with weak and rare peristalsis. Assist dependent patient in dressing and explain the data obtained during palpation. Perform hand hygiene. Record the procedure in medical record as required.